Okay, so looking at the pathologies related to the eye, we're going to begin by just looking at refractive errors. So essentially looking at the various things that basically cause people to need to get corrective lenses so that they could see with normal vision. So for clear vision, both near and distant objects need to be focused onto the retina. So we had talked about in the beginning of this, in the in-class lecture, about how the different structures work and what they're responsible for. So that image needs to be focused on the retina, and then that image then gets transmitted to the brain via the optic nerve. Well, in a case where, and typically this involves the shape of the eye basically being changed, that's what causes either any of these various issues with vision. So myopia, or what's also called nearsightedness, is caused by a longer than normal eye. So in that instance, the distant object the person's trying to look at, so when someone's trying to look at something far away, that distant object actually gets focused in front of the retina instead of on it. So that's why when someone who's nearsighted looks at something far away, they can't see it as good, okay? Hyperopia is produced by a shorter than normal eye. So this is a case where now the distant object is out of focus when it reaches the retina and actually focuses behind the retina. Okay, so that's longer than normal eye, nearsightedness, hyperopia, or farsightedness is now that distant object is now focused actually behind the retina instead of in front. Astigmatism has to do with the curvature of the eye. So whereas the first two have to deal with the how long it is, astigmatism deals with the curvature. So when you look at the curvature of the eye, it should be spherical, okay? In the case where it is not spherical, maybe has more of like almost like an egg shape or like a football, the eye is then considered to have astigmatism, okay? And that could cause some change with the vision as well. Presbyopia is when the lens loses its flexibility. So it's not so much an issue with the shape of the eye, but we had talked about how the lens, as it's being suspended in the ciliary body, looks to focus the object inside the eye. As people get older, and this typically will happen in older individuals, the lens loses the ability to kind of move and be able to focus things, and typically this causes people to have trouble focusing on nearby objects. So this would be typically what you see in individuals who have to use reading glasses as they get older. It's because they have presbyopia and that lens is just losing its flexibility. A conjunctivitis is an inflammation of the conjunctiva. So we had talked about the conjunctiva. Basically, there's two portions of the conjunctiva. There's the film that covers the eye itself, and then it covers the inside of the eyelid. So it's kind of a continuous, again, basically like a film that kind of covers the eye. So this can be caused by a couple different things. So part of it would be determining what type of conjunctivitis you're looking at. It could be caused by bacteria, it could be caused by viruses, it could be caused by allergies, it can be caused just even by just a dry eye in response to either a corneal injury or any type of irritation. The most obvious sign, if you will, if you look at the picture in the bottom right hand portion of the screen, is the bacterial conjunctivitis. So when you get that red engorgement of the eye, and typically with bacterial conjunctivitis, you'll have that purulent discharge coming from the eye. So that's usually will tell you. So again, depending upon what's causing the conjunctivitis will dictate the treatment. Both viral and bacterial conjunctivitis are both very highly contagious. So that's going to be an important thing to consider when you kind of look at, how you're going to have athletes return to play, because obviously you don't want them possibly infecting their teammates. Okay, hyphema, so blood in the anterior chamber of the eye. So again, if you remember anatomically the different parts of the eye, we have the anterior chamber, and you see in the picture here, that little bit of blood that has just kind of pooled in that area. So this is usually a complication of blunt trauma to the eyeball. It can happen through other types of injuries, but that's probably the most common thing that happens. So the blood that forms usually comes from damaged blood vessels, either in the iris of the eye or the ciliary body. And you can see this is how it usually begins. So it starts as that little crescent shape at the bottom of the eye. Okay, so again, typically caused by blunt trauma to the eye. And again, the classic thing that you'll see is this little pooling of blood right down in that anterior chamber of the eye. A subconjunctival hemorrhage, so this is when you get bright red blood now actually acutely in the part of the eye just underneath the clear conjunctiva and right in front of the sclera. So you see here the blood kind of just forming in and around the white part of the eye, the sclera. While this is something that looks, this is the one thing that actually looks worse than it really is in many instances. And this is just because you get some broken blood vessels right below the conjunctiva. And it's actually usually pretty benign as long as it's not associated with any visual problems. This is something that if you see in an athlete that has had trauma to the eye, as long as they don't have any other outward red flag sign symptom, this is usually just something that over the course of time will just sort of heal up on its own and will reabsorb. So again, while it looks, again, pretty significant when you see it, this is usually something that is benign and doesn't really require any further treatment. We had talked briefly about this. So here's a picture of a corneal abrasion. We had discussed in class the use of the fluorescent dye strip, and part of what you use the fluorescent dye strip is to assess to see if there's any abrasion or scratch on the eye. So here you actually have a fluorescent dye strip test that comes out as a positive. So corneal abrasion is, a relatively common thing. It's something that could happen from trauma to the eye. Someone gets poked in the eye, or someone maybe gets something in their eye and they just kind of reactively rub it and it causes a scratch right over top of the cornea. So when this happens, you can test for it because you wouldn't be able to see this without doing the fluorescent dye. So again, what you basically do is you take the little dye strip, you put some sterile water or saline on it, you kind of fold down the conjunctiva on the eyelid, you touch it to the eyelid, they blink, spread the dye around. When you shine the cobalt blue light in the eye, if they have a scratch, the exposed cell from the cells from the scratch on the cornea will kind of show this abrasion. So this would be something you would see with that, utilizing that special evaluation technique. This is a corneal or scleral laceration. So this is probably one of the most serious traumatic eye injuries in the eye, and it's also called, they refer to this as an open globe. So basically the globe, or again the eyeball as it commonly gets referred to as, is when it actually gets ruptured and opens up. And again, this would be typically after a blunt trauma or maybe a sharp object basically cuts the eye open. This is a pretty serious injury. The laceration causes the intraocular fluid to leak out. In addition to it causes extrusion of the tissues inside the eye. In addition to stuff coming out, the risk here is you also get pathogens inside the eye, which can cause infection as well. So this is a pretty significant injury to the eye that requires pretty urgent treatment. Okay, corneal and conjunctival foreign bodies. Okay, so any type of object that embeds itself or adheres itself to either the conjunctiva or the cornea. So here you see in the picture a small object that has kind of embedded itself into the eye in the upper left-hand corner. So, you know, a lot of times individuals that have this will complain of something in the eye, or they'll complain of their eye feels like it's constantly getting scratched. The foreign body may or may not be visible, so it may be deeply embedded. So it may be a situation where an ophthalmologist or an optometrist may have to assess the eye underneath a slit lamp to determine where that object is, and that's typically what they'll use to help them in visualizing and removing the object. The object pictured here actually leaves a rust ring behind, and likely that was because it was some sort of metal foreign object, so it's not that uncommon for that to happen. So if they get something and it constantly just still feels like there's something in their eye, they may actually have an embedded foreign body. So we'll talk about, we've talked about in class, and when you look over your treatments, make note of how they talk about how to safely remove objects without that can be taken out from the eye. If something doesn't seem like it's coming out of the eye, it's very important to make sure you refer them, because they may need a slightly more advanced treatment to help remove the object. So here's just a picture kind of showing you how you could help remove a foreign body. So one way is because sometimes the foreign body could get stuck underneath the eyelid. Now if this happens, you could basically fold the eyelid like they're showing you in the picture with the cotton-tipped applicator. And if you see a foreign body like that, many times if you just take another cotton-tip applicator, I would suggest, and most people would suggest, to moisten it with, again, a sterile saline or a sterile water, because you don't want to just touch the dry cotton-tip applicator to the eyelid, because you leave cotton fibers behind, and then that could be an irritant to the eye as well. But with something like this, then you could safely help to remove it. Again, if you're having a lot of trouble and you're really having difficulty removing the foreign body, when in doubt, refer them right away to, the ER and have somebody with more training perform the removal. Okay, the orbital fracture. So we talked about the bony orbit. The walls of the bony orbit are some of the thinnest bones in the body. So all those bones we talked about at the beginning of class, they're some of the thinnest bones. So, again, the right type of force to the eye could cause them to rupture. Now, if you look here, this could cause the eyeball to get displaced. But one of the things that could happen is that inferior rectus muscle gets entrapped. So if you look at the picture at the bottom showing the sagittal view, they're showing the inferior rectus basically getting entrapped. And if you look at the picture of the individual suffering this, you can see where they're having trouble moving their eye. So again, the most common thing you would see with this, with an orbital blowout fracture, is the inability to look up, because the orbital floor breaks and entraps that muscle, not allowing it to lengthen as the person moves up, and then they'll typically complain of double vision because the timing of the eye is not, they're not moving synchronously with one another. Retinal tear and detachment. There's various reasons that could cause a retinal tear. It could occur through illness, injury, so blunt trauma to the eye, blunt trauma to the head can cause retinal detachments, or it could just be a result of normal aging. So some people, as they age, just changes to the tissue can cause this to happen. So we have two different pictures here, one kind of showing you, again, graphically what it looks like. You could see the retina getting detached. The picture on the left is actually showing you through the ophthalmoscope what you would actually see. Now that's a pretty significant one. So in looking at that picture, that entire picture should have that reddish color kind of going through it all the way through. And I'm calling it yellow because as I'm looking at it on my screen, it looks yellow. That's actually the retina actually folded up. Okay, so many times you find this in people who are nearsighted, who've either undergone eye surgery or have a family history of retinal detachments. Once this occurs, the individual is also at risk for having it happen again. So when you're looking through your signs and symptoms, look at what there are some very pertinent signs and symptoms related to retinal tears and detachment that if somebody does, if you do have an athlete who suffers trauma to the eye and or head and they complain of, they kind of get their significant clues that they could possibly have a retinal detachment. A dislocated contact lens, so many times the contact lens could be moved from their normal central location over the cornea. So, again, people wear contact lenses. It's very common for athletes to wear them just because then it allows them to see and they don't have the issue of having to wear a corrective lens while they're playing. They could just basically wear the contact lens. And this could happen from any type of trauma from a hand, so they get poked in the eye. The most common thing right away is obviously a loss of visual acuity and the presence of a foreign body sensation. So in looking at this, kind of take a look at, number one, how you should handle the contact lens. If it gets just displaced in the eye, how you can kind of help the athlete sort of locate it and get it to come out from other locations other than being right in the center of the eye. Chemical burns to the eye, so when a chemical substance comes in contact with the eye, it can cause a pretty serious burn. So again, obviously a lot of pain, possibly loss of vision can accompany this. Various things could be initial signs of a chemical burn. One of them could be, depending on the chemical, an actual defect on the corneal surface, which you're actually seeing in this picture here. Possibly blanching of the cornea or conjunctiva. So this would be something, again, that would require, certain immediate first aid. Again, as I've said before, make note of the specific treatment of this as you're kind of going through and looking at your signs and symptoms and treatment for this. A periorbital contusion, so anytime you have direct trauma to the periorbital structures, again, people just typically refer to this as a black eye, so you get your localized swelling and subcutaneous hemorrhage. This many times will also coincide with a subconjunctival hemorrhage as well, so many times when people do take trauma to the eye, in addition to having the periorbital contusion, they will eventually many times develop a subconjunctival hemorrhage as well. And again, as long as there's no visual problems, no obvious deformity within the eye, this is just something that over time will kind of heal itself. But again, very important, anytime there's significant trauma to the eye, thorough evaluation, as long as there's no red flags, no obvious deformities, no visual problems. That's something that many times just has to heal over time. Traumatic iritis, so it's inflammation of the iris or the anterior chamber, and again, this will happen due to blunt traumatic injury to the eye. So the common thing that will happen is a deep, dull, aching pain with any time the iris or pupil moves. So we know that the iris is kind of the muscular structure that helps in dilating and constricting the pupil, which the pupil allows light to enter the eye. Sometimes this can actually occur up to a week after the initial trauma. So, this isn't necessarily something that would happen right away. And many times the diagnosis for this requires a slit lamp to do. So an eye doctor would have to do this. So if you get somebody that develops after an eye trauma, this dull, deep aching pain, they would need to be referred for examination right away. Proptosis is direct trauma to the orbit that results in deep orbital swelling and hemorrhages. So what could happen with this is it can actually cause the eye to be pushed forward. So it can cause the globe to get displaced and bulge forward. The issue with this is it can actually cause direct trauma to the optic nerve because the swelling and the actual pushing forward of the globe compromises the blood supply to the optic nerve. And again, the optic nerve is the structure that takes the visual signal to the brain for the brain to interpret it. And what this will typically present with is a bulging eye. So again, as a part of your assessment, when you have trauma, make sure you have symmetry on both sides as far as the shape of the eye and how it's kind of situated inside the orbit. So here is just a picture of a retrobulbar hemorrhage with proptosis. So you can see the eye kind of getting pushed forward. So here we had a pretty significant trauma to the eye. Again, the fear here is that you can have a possible circulatory compromise to the optic nerve, which then could have a pretty big impact on vision later on. Okay, eyelid lacerations. So the eyelid skin is basically the thinnest skin on the body. So there is some thicker periorbital skin that overlies the orbital rim. So any of this can be, again, possibly subjected to direct trauma. So an eyelid laceration will basically look like an open wound just right around the eyelids. You need to make sure that in addition to managing the eyelid laceration, that you make sure that there's no other foreign bodies in and around the eye, and that again you still do a full ocular exam. Again, the eyelid would have to be treated fast because it would have to get treated appropriately, but you still want to do your complete eye exam to make sure that nothing else has happened, because if you have a trauma that causes the eyelid to be lacerated, it could also cause something to the actual globe itself. So you want to make sure in your treatment for first aid, as you're getting the person ready to refer them, that there's no other further trauma to the eye, to the globe itself. And then just a note on protective eyewear that the chapter kind of wraps up with talking about protective eyewear. So again, eye injuries are pretty significant. So anytime an individual can protect their eyes, very important. And various statistics are up here. So it's more just a take-home point in looking at, in situations where the eyes can be protected to do it. So we don't want to have any vision loss associated, because many of the serious eye injuries will result in some type of visual impairment. So we certainly want to try to protect the eyes as best we can. So important that any time an athlete can wear eye protection. Obviously in some sports, over time they've actually mandated eyewear. So for instance, like in women's lacrosse, wearing the eyewear that they currently started to wear, I want to say they began wearing that, I believe, around 2004, 2005. I could be a little off with that, but it's a relatively new thing in women's lacrosse for them to wear protective eyewear. But again, to protect the eye from getting hit with the ball, which can cause some pretty significant eye trauma. So that wraps up all of the different eye pathologies. So a couple things of note. Make sure, again, as always, signs and symptoms and treatment, but note which eye injuries require immediate referral. Okay, so there are some eye injuries that require emergency care referral to prevent permanent loss or permanent impairment in vision. Make sure to make note which ones those are, and then how, in referring the individual, how they would be transported. So when you go to protect the eye, there are some eye injuries where obviously you can't put anything that would put pressure on the eye. If you're going to put an eye shield on, it has to be an eye shield that does not touch or put any pressure on the eye. So again, make note of that as you would, but again, in particular, the eye injuries that would require immediate referral.